We start off with the latest from the United States, where the state of New York has now recorded more cases than any other country in the world. The United States is currently grappling with what could be the country's hardest week of the coronavirus pandemic. New York recorded its deadliest day of the crisis with 799 deaths in the last 24 hours. However, the rate of hospitalizations in the city has witnessed a sharp drop. But as New York accounts for nearly half the total death toll in the country, New York Governor Andrew Cuomo compares this tragedy to 9/11.
"9/11 was so devastating, so tragic, and then in many ways we lose so many more New Yorkers to this silent killer. There was no explosion. But it was a silent explosion that just ripples through society with the same randomness, the same evil that we saw on 9/11.
But what New York's death toll data now shows is that people from minority communities are also succumbing to the disease, and that too at a disproportionate rate. The Hispanic and African American communities comprising the majority of the deaths in the state. Opening new testing sites primarily in these communities is now a priority there. New York City Mayor Bill de Blasio has also warned that restrictions may last until June. Landmarks across the state were lit up in blue, meanwhile, to show support to all the healthcare workers fighting on the front lines. The New York State is also burying its dead on Hart Island. On your screens now are the visuals of the workers burying the dead. Nearly 25 bodies are buried every day on this island, which sits off the east shore of the city's Bronx borough and is accessible only by boat. Meanwhile, American economy is currently reeling under the crisis. The rate of unemployment is also rising at an alarming rate. Recent data showing that more than 17 million people have lost their jobs since mid-March. This is the biggest job loss in the country since the Great Recession in the 1930s. However, President Trump continues to believe that the American economy is going to do very well.
Well, I think the economy is going to do very well. Now, that's just my feeling. It's a strong feeling. I've had good, proper feelings about a lot of things over the years, and I think we're going to do well. It looks like we're at the lower end of the curve in terms of death, which is a terrible word, a terrible, dark word that we've experienced like nobody's ever seen before in this country.
Meanwhile, U.S. hospitals are using plasma from the bodies of the recovered patients to treat those infected with COVID-19. People who survived COVID-19 are left with blood containing antibodies or proteins made by the body's immune system to fight off the virus. The blood component is then given to the newly infected patients. This treatment was also successfully used during the 1918 Spanish flu pandemic. Our correspondent Simon Marks is now joining us live on the broadcast from Washington, D.C. Hi, Simon. Amidst the worrying figures, there is a glimmer of hope that the rate of hospitalizations in New York has witnessed a sharp decline.
Yeah, I mean, it's fascinating because this becomes a story essentially not just about the humanity of those people in the front lines in the battle against coronavirus and, of course, those people who have tragically died, but it also becomes a story about the numbers. And while on the one hand the numbers continue to show record numbers of people dying in 24-hour periods in New York City, the numbers also show that the number of new patients arriving at hospitals for treatment is beginning to fall slightly, and that the demand for new patients entering intensive care units in New York State is also beginning to level off somewhat. And so Governor Andrew Cuomo of New York says these are obviously positive signs. They may suggest that New York is moving past the peak as far as at least this first wave of coronavirus is concerned in his state. But he's very worried that it's going to lead to a sense of complacency among New Yorkers. He is urging them in no measure to stand down, to relax their guard, to stop observing the social distancing guidelines and the law that is now in place, telling them to stay at home. So he's one of those state officials across the United States, and there are many others in hotspots that have already been identified, and some of those that may yet emerge, also eager to make sure that people get the message. You've got to stay locked down.
Indeed, a lot of studies across the world, Simon, on whether a rise in temperatures will slow down the spread of the virus. Now, the head of the U.S. Coronavirus Task Force, Anthony Fauci, has also stepped in, saying that the virus, he says, will continue to do its thing, and we should not think that a rise in temperatures will actually lead to a slowing down.
Yeah, there's two elements to this change in the weather as far as coronavirus is concerned. First of all, the question about whether warmer temperatures, and we're beginning to experience them here in Washington, D.C. as we come out of winter and head into spring, will those warmer temperatures in and of themselves help to vanquish coronavirus? Well, Dr. Fauci says they don't have the data on it yet, but there's no reason to believe that coronavirus will become, for example, less transmissible in warmer weathers than it was in colder weathers. But the big difference that he argues the weather is going to make is that once we get into spring and summer in the United States, seasonal flu and seasonal respiratory diseases that are augmented during the winter, those will fall away. And the impact of that will be that those diseases, flu, respiratory diseases that are related to the winter season in the United States, they will be putting less pressure for attention on the healthcare system, giving the healthcare system more of an opening to deal with coronavirus cases. So given that this is all about trying to flatten the curve so that the healthcare system is more able to cope with coronavirus, in that regard, Dr. Fauci says the warmer weather might help.
Very interesting. We're going to leave it there for the moment, though, Simon. Thanks very much for those updates and perspectives.